Welcome to Wally's Nursing Videos, your go-to destination for a deep dive into the intricate world of nursing education. Whether you're a dedicated oncology nurse, a healthcare professional seeking to expand your knowledge, or someone touched by the challenges of cancer, this channel is designed to be your beacon of information and support. We're here to unravel the complexities of oncology medications, exploring their mechanisms, side effects, and nursing considerations. Join us as we navigate the ever-evolving landscape of cancer care, sharing insights, expert guidance, and stories of resilience from the front lines. So hit that subscribe button and let's embark on a journey to understand, heal, and conquer the realm of oncology medications together. Drug therapy for cancer treatment. Cytotoxic anti-neoplastic drugs. Cytotoxic drugs are a critical part of cancer treatment as they are designed to cause the death of cancer cells. It's important to note that these are high-alert drugs, meaning they can have severe consequences in the event of a medication error. Consequently, they must be administered by personnel with appropriate training, and the administering healthcare professionals should wear appropriate personal protective equipment, PPE, during the administration. Furthermore, the intravenous IV access must be carefully assessed for excellent flow before administration. Alkylating agents, example, cyclophosphamide, Cytoxan. Mechanism of action, cell cycle phase nonspecific. They interrupt DNA replication and interfere with subsequent cell division. Common side effects, alopecia, hair loss, anemia, bleeding, fatigue, mucositis, inflammation and erosion of oral mucous membranes, nausea and vomiting, NNT-V, neutropenia, myelosuppression, bone marrow depression, thrombocytopenia, low platelet count. Nursing considerations, assess liver function before administration. Administered by a certified or trained chemotherapy RN. Ensure patent IV access. 2 RN verification of medication order before administration. Proper disposal of medication and contaminated materials in hazardous material bins. Carboplatin, platinum compound. Mechanism of action. Cell cycle phase nonspecific. Interrupts DNA, RNA, and protein synthesis. Nursing considerations. Watch kidney function. Assess liver function before administration. Use in older adults should be carefully monitored due to their increased risk of adverse reactions. Antimetabolites. Example, methotrexate, Rumitrex. Other uses, rheumatoid arthritis, Crohn's disease, psoriasis, abortion. Mechanism of action. These drugs are generally S-phase specific and act as folate antagonists, blocking the conversion of folic acid into its active form, disrupting DNA synthesis. Anti-tumor antibodies. Example, daunorubicin, cerubidine. Mechanism of action. Cell cycle phase nonspecific, disrupts DNA and RNA synthesis, similar to alkylating agents. Unique note, this medication is administered through IV only and is known for causing red-colored urine. Plant alkaloids. Example, vincristine, Vinkezor. Mechanism of action. Cell cycle specific agent that interferes with mitosis. Common side effect. Peripheral neuropathy. Special note, this medication should be administered through IV only and is a vesicant, which means it can cause severe adverse effects if administered with mitomycin C, an anti-tumor antibiotic. Adjunct medications used to treat cancer. Biologic anti-neoplastic drugs. Biologic anti-neoplastic drugs stimulate the immune system to fight cancer cells and inhibit their growth and proliferation. They can be used alone or in conjunction with other cytotoxic therapies. Kinase inhibitors. Example, erlotinib, Tarceva. Mechanism of action. These drugs act as growth inhibitors, blocking growth factors, inhibiting cell proliferation, and inducing cell death. Common side effects, leukopenia, thrombocytopenia, skin rashes, diarrhea. Nursing priorities, managing hydration, electrolytes, and skincare. Self-administration can occur in the home setting. Monoclonal antibodies. Example, alemtuzumab, Campath. Mechanism of action, these drugs bind to an antigen on normal T and B lymphocytes and malignant lymphoid cells, activating antibody and complement-mediated cytotoxicity, making the malignant cells more susceptible to immune destruction. Common side effects, fewer side effects than cytotoxic drugs. Serious side effects include heart failure, bleeding, and electrolyte imbalances. Nursing considerations, administered through IV only to prevent being destroyed by GI enzymes. Watch for and respond to hypersensitivity reactions. Anti-neoplastic hormone inhibitor drugs. Anti-estrogens. Example, tamoxifen, Nolvadex. Mechanism of action: blocks estrogen receptors in some tissues and activates them in others. This is known as a selective estrogen receptor modulator, SERM. Common side effects: hot flashes, vaginal discharge, nausea, and vomiting. Special note, these drugs carry an increased risk of endometrial cancer and thrombosis. Aromatase inhibitors. Example, anastrozole, Arimidex. Indications: used for ER-positive breast cancer in postmenopausal women only. Mechanism of action: inhibits estrogen synthesis. Common side effects: nausea, hot flashes, and edema. Drugs that treat neutropenia. Cytoprotectant drugs. G-CSF, granulocyte colony stimulating factor. Example, filgrastim, Neupogen. Mechanism of action: identical to human G-CSF, stimulates the production of neutrophils. Common side effect: bone pain, 25%. Cost, approximately $3,500 per course of therapy, IV or SQ, daily for 2 weeks. Special note, reduces hospitalizations and infections, but it must be administered at least 24 hours post-chemo. Now, let's briefly discuss the management of some common complications associated with cancer treatment. Complications and management. Nausea and vomiting. Antiemetic medications are given on a regular schedule 24-48 hours after chemotherapy administration. Examples: ondansetron, serotonin receptor antagonist; dexamethasone, corticosteroid; lorazepam, benzodiazepine; anorexia. Provide patients with antiemetic medications before eating. Educate patients to consume high-calorie and high-protein meals. Consider supplements such as Ensures or Boost. Fatigue. Secondary to anemia, manage with erythropoietin. Encourage alternating periods of rest and activity. Alopecia. Suggest the purchase of wigs, hats, or scarves. Hair typically grows back after chemotherapy treatment is stopped. Mucositis. Lasts 7-10 days. Can interfere with nutrition and are painful. Educate patients to brush with a soft toothbrush after meals. Rinse mouth several times a day with a mixture of salt, baking soda, and water. Encourage fluid intake. Encourage soft, bland foods to avoid irritating ulcers. Inspect the mouth daily for new sores and signs of infection. Infection. Chemotherapy treatment lowers host resistance to infections. Administer filgrastim to stimulate bone marrow production of leukocytes for severe neutropenia. If patient has fever, needs workup to determine source, X-ray, CBC cultures. Patient should avoid exposure to infections. Avoid large crowds. Frequent hand hygiene. Avoid people with known infection. Minimize exposure to soil, animals, and animal excrement. Maintain daily hygiene, a well-balanced diet. Provide indwelling catheter care, central line hygiene, and maintenance. Bleeding can be caused by thrombocytopenia. It may occur spontaneously or with minor trauma. Administer oprelvecin to stimulate platelet production. Follow bleeding precautions if platelet count is lower than 50,000 mil-3. Extravasation. Some chemotherapy agents, called vesicants, can cause severe inflammation, pain, ulceration, and tissue necrosis if they leak into tissues. Identify patients who are at risk. Patients who are unable to communicate, sedated patients, infants. Choose peripheral IV sites carefully. Do not use veins that are small. Administer drugs per order. Do not free-flow medications. Frequently assess sites for SIS of extravasation. Educate patient on SS of extravasation and to notify RN. If extravasation occurs, Step 1, stop infusion of medication immediately. Step 2, try to aspirate the drug. Step 3, elevate extremity. Step 4, apply warm compress. Hyperuricemia. Rapid breakdown of malignant cells can cause kidney damage. Manage with high fluid intake, alkalinizing urine with sodium bicarb administration, and allopurinol to inhibit uric acid formation. Hand-foot syndrome. Rash with redness, tenderness, and possibly peeling. Numbness and tingling of palms and soles. Drug leaks from capillaries into palms and soles. Decrease leakage. Decrease heat and friction and minimize exposure to hot water. Avoid increasing pressure, long walks, and you should apply ice packs for 15-20 min at a time. Thank you for joining us in this exploration of oncology medications on Wally's nursing videos. We hope you've gained valuable insights into the intricate world of cancer treatment and the critical role that nursing plays in it. Remember, the journey of learning and growth never truly ends, and the field of oncology continues to evolve. Stay connected, stay curious, and stay committed to making a difference in the lives of those affected by cancer. If you found this content helpful, don't forget to like, share, and subscribe for more informative nursing videos. Until next time, take care and keep making a positive impact in the world of healthcare.